Okay, for this video, we're going to talk about our medical student textbooks, a joke. And the reason I'm going through this is because when I was a young guy, I was very interested in learning medical stuff and trying to learn as much as I could. I was quite enthusiastic about learning stuff, and for example, biochemistry. And once I like to study biochemistry, I would have 3 or 4 books out and try to ask myself, what is the essence of this metabolic cycle? For example, like glycolysis, and then I would recognize in glycolysis, it's the phosphate, make a mnemonic for it. And after I'd studied that quite a lot and taken my boards, and that was considered nutrition as well, was incorporated into biochemistry, I thought, gee, I know biochemistry pretty well. And what I'm saying is, I think most medical students think that way. Once they know a textbook quite well, they know that subject. And what I'm here to tell you, real world clinical experience is much, trying to get that in the picture, much more important than a book. I mean, it's good to read the textbook, get an introduction. I'm also going to tell you, if you want to learn something in biochemistry, the biochemistry books, they're all out of date, and not just out of date. You open up a biochemistry book, and you'll have like 10 pages of advertisements, and what's happening is the biochem book has to get approved by a committee, and the committee stinks. The committee is always going to downgrade the book. So in order to not offend the committee, they take out all the controversial stuff, and that's really the most important, most interesting stuff. So the biochemistry books, and this is like all of them, I own a whole bunch of them, they're all watered down. All of them avoid the controversial subjects. They avoid the most important subjects. How can you learn biochemistry when the most important subjects aren't in the book? They give you a base, an introduction to biochemistry, so you can subsequently learn pharmacology and physiology. And then typical stupid thing in a biochemistry book, it'll recommend a high-fat diet. And, high-fat diet's a joke. Once you've actually studied nutrition, you'll recognize there's no healthy population that eats a high-fat diet. Every emigrated population was typically healthy, eating their primarily plant foods in their in original environments, indigenous environments, and once they come and get urbanized and eat all this processed food, meat and junk food, they all get fat and sick and diabetic and hypertensive. So anyways, why else do medical student textbooks tend to be a joke? Because typically they're written by young people. They're written by fellows in a specialty. You'll tell the fellow. The attending gets paid to do clinical work and to publish research papers. That's what they get promoted for, go to a national meeting. Nobody gets paid practically to write a textbook. So a textbook's considered scut work, work that you don't want to do. So a typical thing an attending at a university program will do is they'll say, have the fellow write it. Now the fellow is somebody who's completed a residency, is getting specialty training in that field, but they really don't know much. Fellows don't know much. I'm actually going to give a recommendation to you. If you want to get the best doctor for yourself, for your family, go for the older doctors. And when I say older, at least 45 years of age, a doctor who's interested in learning, they keep getting better. They're better in their 50s. They got a lot of clinical experience. They know what's real, they know what's not real, they know what works, they know what doesn't work, they know how to predict what's going to happen in a lot of situations. A young guy mostly just goes by the book and quotes you a bunch of guidelines, okay? And also a doctor makes a decision. It don't matter so much where they came from. A doctor makes a decision in their mind. Are they going to keep learning? Are they going to stay up to date? Are they going to read in other fields so they've got a wide knowledge? Or are they just going to get by, go by the guidelines, get paid, play it safe and stupid? All right, so anyways, just to give you one example, let's say you want to learn about iron metabolism. In a biochemistry book, there'll be either half a page, maybe if you're lucky, a page and a half, and it'll all be Mickey Mouse, worthless stuff. If you want to learn iron, I was curious about the biochemistry of iron in the human body because it actually ends up being a really important, interesting study. Here's just one book, really good book. Here's another book. And these are written by individuals. They put it all together. Here's another book on biochemistry of iron. Here's another book on biochemistry of heavy metals and the relationship to neurodegeneration. I was real interested in neurodegeneration. I'm a neuroradiologist. It's one of the main things I do. But the point I'm making is to learn a subject, let's say you want to learn about the role of iron in neurodegeneration. Biochem book is like, kindergarten and compared to really learning the subject. And now, like I said, they'll recommend things that are absolutely stupid. High-fat diet. That's the way you cause diabetes and coronary artery disease. So I was just embarrassed when I read these biochemistry books. I'm like, God, I thought I knew biochem. All right, what else? Let's talk about a neurophysiology book. You read a neurophysiology book. The most important thing in neurodegeneration is to have some understanding of excitotoxicity and how that causes dementia. All right? And there's a lot of things that factor into excitotoxicity in the hippocampus. So and you read a neurophysiology textbook, a neurology textbook, it'll be 1,600 pages, and there'll only be a paragraph on excitotoxicity in the context of stroke, post-infarct, lack of blood supply, lack of oxygen in the brain tissue, and you can get this negative cycle going whereby glutamate is released from a dying neuron and it subsequently overactivates an adjacent neuron, and then that one dies because it doesn't have the metabolic resources, glucose and oxygen, to process all that neurotransmitter effect. So anyways, all right, next thing to talk about these textbooks. They almost talk at all about stress. Psychological stress and its contribution to excitotoxicity is a fascinating, important subject, and there's a lot that's known about it. Psychological stress is not just an emotional thing. It's a major physiological thing that makes the blood prothrombotic and causes overactivation of glutamate neurotransmitters in the brain, which subsequently can overexcite the postsynaptic neuron. And in the context of hypoxia or hypotension, etc., that postsynaptic neuron can die through apoptosis, lack of blood supply, and metabolic demands high and oxygen glucose supply low. So anyways, excitotoxicity, stress, super important. Virtually nothing in these giant 1,500 page books. They're a joke. Okay, multiple sclerosis. There'll be nothing about leaky gut. How can you talk about MS and not know about leaky gut and dairy and Rice Swank, neurologist, and Dr. McDougall's work? I mean, it's like, it's kind of a joke. Okay, so the student comes out of med school all, bright-eyed and bushy-tailed and ready to save the world. And the truth is, I like medical students. They're very nice, they're intelligent, but they really don't know much. They just have this little introductory knowledge. They mean well. They're on their way to learning, hopefully. Next thing, pathology books. You open a pathology book, like I said, the entire chapter on autoimmune disease. There'll be nothing on leaky gut. Leaky gut's the most important thing you can know about in the context of autoimmune disease. If you got an autoimmune disease, that's one of the things you should do. Study the long list of things that cause leaky gut and avoid them. There's a few other mechanisms of autoimmune disease. Be aware of them, advanced glycation end products, and there's a few other things that can do it as well. What else to talk about here? Hypertension. You open a cardiovascular physiology book or a pathology book on hypertension. They'll tell you 90 to 95% hypertension is essential, meaning that unknown cause, idiopathic. The doctor's an idiot and the patient's pathetic. That's what idiopathic means. It's a joke. Okay, but the point I'm saying is hypertension is not 95% essential, idiopathic. It is not. If you go to a population that doesn't add salt to their food, like let's say the Tarahumara in northern Mexico, let's say the Yanomamo, they only eat 200 milligrams of sodium a day in Brazil, South America, and you look at Walter Kempner MD's patients where they fed them a low sodium diet, they don't have any hypertension, okay, next to zero. It'll be less than 1%. And there's lots of populations where that's been shown. Rural Kenyans, anytime that's studied, a plant-based population will have next to no hypertension from the lack of dietary fat, the lack of dietary sodium in particular. Plant foods tend to be high in potassium and magnesium and low in sodium. The westernized diet or the SAD diet is the opposite, very high in sodium and very low in magnesium and potassium, and that causes hypertension. There's other things that cause hypertension. Of course, being stressed. The cortisol of stress is a mineralocorticoid activity such that it causes increased sodium reabsorption from the kidneys. That raises blood pressure, and there's a few other things too. But the key point is it's not an unknown cause. All right? I mean, there are some other causes, but they're all super rare. Renal artery stenosis and a few other things. Pheochromocytoma, that's all rare stuff. Those are zebras. Those aren't even zebras. They're so rare, those are okapis. The old joke is when you hear hoofbeats, think of a horse, okay? And zebras is a rare disease. Okapi is like a vanishingly rare disease. They'll also talk in coronary artery disease, cardiovascular physiology book, about stents and surgery. They won't even mention the pioneers of atherosclerosis. Like Dr. Kempner, Nathan Pritikin reverses EKG, the work of Dean Ornish, the work of Caldwell Esselstyn. You won't even hear anything about that. And that's a very powerful way to prevent, minimize, and even in some instances, partially reverse atherosclerosis. You can reabsorb an atherosclerotic plaque. You can reabsorb the lipid component. You're not going to reabsorb the fibrotic component. You're not going to reabsorb the calcific component. But even reabsorbing that small amount of lipid that can be taken out of the plaque. And what happens is the endothelium, the lining cells of the artery, start to function better when a person's eating a healthy diet. And that causes the arteries to vasodilate. So a person can get a big improvement in blood flow relatively quickly by improving their diet and lifestyle, for example. Okay, what else? Radiology textbooks. You look at a radiology textbook. They're pretty good at describing the finding. At least how do you recognize the basics of it? They're pretty good for that. They've got good imaging. They're aesthetically the most beautiful books. They're pretty good at talking about pathology. But what they stink at is pathophysiology. You look at a spine. I wrote actually 2 books on the spine. I think ischemic spine is the most common cause of back pain, is the best one. And the gist is this. Everything in the body, as people get older and accumulate more atherosclerosis in a westernized population, suffers from a lack of blood flow. There's total body ischemia. I just made that word up, and it's a good thing to remember. Everybody knows you can get heart disease from lack of blood supply due to atherosclerosis in the arteries of the heart, the coronary arteries. You can get cerebrovascular disease, and that'll cause cognitive impairment routinely in the brain. And what I'm saying is, but they go to the spine and they think there's nothing you can do for the spine except, take a pain pill, inject a steroid, or do a surgery. No. It's a big benefit to the spine to improve the diet, to improve blood flow, and just walking, okay? Because when one disc space fails, it puts increased stress on the adjacent disc spaces, then those fail. And the whole process kind of walks its way up to the top of the spine. So when you see things like diffuse idiopathic skeletal hyperostosis, it'll go to every level of the spine. Same thing with degenerative disc disease. And it's primarily an ischemic phenomenon, okay? All right, what else was I going to say? That was really the key point. Anyways, I hope that was interesting for you. Oh, one last thing I'll tell you. Just like, for example, atherosclerosis. There'll be a little joke of a comment in a cardiovascular physiology book or a pathology textbook. And these I'm talking are, 1,800-page books, okay? But it's a joke. They'll say something like, cholesterol, explains atherosclerosis, and they'll talk about ruptured plaque. Oh, give me a break, okay? There's so much more to atherosclerosis than that. I'm going to show you the best book ever written on atherosclerosis. Here it is. Blood Viscosity, Its Role in Cardiovascular Pathophysiology and Hematology by Gregory Sloop. This guy is currently the best researcher in the world on atherosclerosis, and this really explains, if you really want to know atherosclerosis, you have to study viscosity, okay? Hemorrheology, another word for studying blood viscosity, that's the secret to really understanding it. I did a fellowship in interventional radiology with the emphasis on vascular disease. I've been interested in atherosclerosis for over 25 years, and I can assure you, this is the best book on atherosclerosis. But to learn atherosclerosis, I'll read a lot of stuff. I like this book by Haverich. He's a cardiac surgeon. He talks about the vasovasorum theory. Here's a nice book on cerebrovascular atherosclerosis by Jack Delatorre. And I've read a whole bunch of other books on atherosclerosis. It's a fascinating subject. But hemorrheology and viscosity and the work of Sloop is the best. He has a good video online. I think it's called The Importance of Measuring Blood Viscosity. Sorry about the dog. Anyways, the key point to get out of this is you don't really know a subject just because you memorized that chapter in the textbook. If you really want to be knowledgeable about a subject, you need to read specialty books. And I like these old guys. These old guys, they're ready to retire. They've been ignored the whole career. So they sit there and they tell you about their field. And the one author, like let's say in these iron biochemistry books, they put it all together and you can understand it real fast. I mean, it's good to read scientific papers, but the books sort of launch you to the paper. And nowadays there's so many videos on the internet that can really help you a lot. So anyways, this is just some things to know so you can really help people. And why do I matter? Why is this a big deal to me? Because in a sense I screwed up a little bit. I wish I could have helped my father more if I'd have learned about the vegan diet more for coronary artery disease prevention. And I think I could have helped my mom more if I'd have realized, just because I memorized all the cancer-related stuff as a medical student, I could have learned more if I understood the relationship of diet to nutrition and the psychological issues and stress. So anyways, I hope that helps you.